a cephalosporin antibiotic that can be used for MRSA. That was the homework. Nobody has done? Yes? What is the antibiotic? Vancomycin is a cephalosporin drug. Nah, the question was, what cephalosporin antibiotic can be used for MRSA? MRSA is resistant to all the cephalosporins. But there is one cephalosporin which can be used, which has anti-MRSA effect. Okay. What is the answer? Have you heard something called ceftobiprole? Ceftobiprole শুনেছো? Pharmacology class হচ্ছে তো? হ্যাঁ? How many classes of cephalosporins are there? হয়ে গেছে cephalosporin? হয়নি? Ceftobiprole is one antibiotic which has anti-MRSA effect, which is actually a cephalosporin that can be used. ঠিক আছে? Usually we don't give cephalosporins in MRSA, we give vancomycin as you said. But there is one antibiotic which is a cephalosporin called ceftobiprole that can be used. Okay, so today's discussion is on viral exanthems. Exanthems mane ki? What is exanthem? First bench. What is exanthem? Bolo. Rash, correct. So sit down. So any kind of rashes which has a widespread distribution in the body are called exanthems. Okay? So we'll be seeing what kind of viruses do produce rashes, and yes, virus je exanthems gulo we see daily, most of them are caused by viruses. খুব কম ব্যাকটেরিয়াল ইনফেকশন আছে যারা কিনা widespread exanthems করে. Most of the exanthems are caused by viruses. ঠিক আছে? We know some viruses. For example, you know, name any virus that can cause rash. বলো দেখি, এই যে ফার্স্ট বেঞ্চ, one virus that can cause rash. জানো তো বটেই, ছোটবেলায় হয়েছে। হ্যাঁ? Measles. See? Anything else? Very common. Measles সবার নিশ্চয়ই হয়নি, বাট একটা জিনিস সবারই হয়েছে প্রায়। রুবেলা। হ্যাঁ, রুবেলা ঠিক আছে, I agree, but সবার রুবেলা হয় না। Chickenpox. See, that is the commonest rash, giving virus, Chickenpox. Chickenpox তো maximum লোকেরই হয়, তাই না কি? Okay, so we'll see. So as I said, these are the viral infections. কিছু কিছু ক্ষেত্রে few drugs can also cause exanthems, but those are exceptions. We have herpes simplex, which is very important, very, very important. You know, herpes simplex is the most common infection that is present. It is said that the western part of the world is affected with HSV so much that 80% of the population has HSV type 1 antibody in their blood. It is very common, HSV1. And most HSV1s are unnoticed, so you won't get any symptoms. Only rarely you will get symptoms when your immunity is down. We'll come to it. Then you have Varicella-Zoster, you have Epstein-Barr virus, you have HHV, human herpes, you have DNA virus এর মধ্যে আসছে, pox আসছে, smallpox, Parvovirus and human papilloma virus, RNA virus এর মধ্যে আসছে measles, rubella and coxsackie. Okay. So starting with the first thing, which is the herpes virus. Herpes virus is a large virus, 200 nanometer. They usually have the diameter of 150-200 nanometers. They have a spherical shape and icosahedral symmetry. Obviously, it's a double stranded DNA virus, and they are classified into alpha, beta and gamma herpes virus family. তিনটে ফ্যামিলি আছে, তিনটে ফ্যামিলির মধ্যে অনেক রকম ইন্ডিভিজুয়াল ভাইরাস এক্সিস্ট করছে। আলফা ফ্যামিলির মধ্যে যে মোস্ট ইম্পর্টেন্ট ভাইরাস, দোজ আর herpes simplex 1, herpes simplex 2 and varicella-zoster. ঠিক আছে? তিনটে ভাইরাস which is very important, VZV, HSV1, HSV2, which belongs to the alpha family. বিটা ফ্যামিলির মধ্যে আছে সাইটোমেগালো, আর হিউম্যান হার্পিস ভাইরাস 6 and 7 এটার মধ্যে সাইটোমেগালো ইজ ভেরি ইম্পর্টেন্ট গামা ফ্যামিলির মধ্যে আসে Epstein-Barr ভাইরাস Epstein-Barr ভাইরাস ইজ অলসো ভেরি ইম্পর্টেন্ট and Kaposi sarcoma associated herpes virus okay so তিনটে ফ্যামিলি আলফা বিটা and gamma HSV1 and HSV2 if we compare both they are similar viruses but তাদের site of infection is different route of infection is also different okay so HSV1 is transmitted mostly by direct contact with any contaminated particles or any contaminated human beings saliva or secretions that is how HSV1 is transmitted HSV2 is different HSV2 is a STI it's a sexually transmitted infection and it can also be transmitted in the vertical way that is from mother to fetus okay so HSV1 is mostly direct contact with saliva secretions HSV2 is a STI okay don't get confused next you have latency latency mane ki latent period means what that the virus will rest it will not be active it will be latent so this HSV1 has trigeminal ganglia as the latency site and HSV2 as because it is a STI automatically the latency site becomes sacral ganglia okay so HSV1 is mostly seen in young children HSV2 adults HSV1 এর symptom আলাদা HSV2 এর symptom আলাদা HSV1 এ কি symptom থাকবে mostly you will have oral and facial lesions HSV2 তে symptom থাকবে you will have genital lesions and skin lesions below the waist so above the waist herpes simplex lesions is because of HSV1 below the waist HSV lesions are because of HSV pathogenesis okay so what happens is the primary infection it occurs through the skin abraded mucosa or genital contact or whatever droplet infection it spreads সেখান থেকে they come along to the nerves they go to the trigeminal ganglia or the sacral ganglia they give rise to a latency so the virus sleeps off now what happens is in case there is a immunocompromised status সেখান থেকে কি হবে the viremia will again start there can be a disseminated infection to many organs like liver okay then they'll have a systemic manifestations as I said HSV1 mostly escapes clinical manifestation sometimes and they'll be presenting only when the primary the immunity is low you will have fever so অনেক সময় আমরা দেখি না যে you have certain blisters that are there by the angle of the mouth জল ঠোসা বলা তাই তো so those are mostly HSV1s ঠিক আছে so that is very common okay so this already I said recurrent infection কখন হচ্ছে যখনই body is under stress you are having fever you are having stress you are having a trauma you are having any kind of exposure to UV light spectrum then the triggering infection can occur তখন secondary viremia can occur and the associated symptoms will come up so these are the infections oral and facial lesions in HSV1 you know buccal mucosa te থাকবে you can have pharyngitis you can have gingivostomatitis এবং you will have a herpes labialis or which is called a cold sore herpes labialis that is nothing but HSV1 other lesions tonsillitis থাকতে পারে eyelids এ হতে পারে so these are all because of HSV1 কিছু কিছু ক্ষেত্রে যদি লিশনটা অনেক দিন ধরে persist করছে then you can have a secondary bacterial infection of Staph aureus mostly in the lesion and then can give rise to pus filled vesicles mostly they won't have pus filled vesicles but যদি long standing lesion থাকে patient immunocompromised status থাকে then you can have a pus filled vesicle or secondary infections আচ্ছা complications কি হতে পারে the most common complication of HSV is meningoencephalitis you can have meningitis you can have encephalitis so acute encephalitis syndrome যদি diagnosis হয় one of the differential diagnosis comes as HSV. So you see the PCR panels. এখন আমাদের কাছে যে পলিমারেজ চেইন রিঅ্যাকশন মাল্টিপ্লেক্স পিসিআর যেগুলো রয়েছে, মাল্টিপ্লেক্স পিসিআর মানে হচ্ছে যে one syndrome there are 10 organisms or 20 organisms that can cause one syndrome. For example, LRTI, lower respiratory tract infection, can be caused by Klebsiella, that can be caused by Acinetobacter, that can be caused by Haemophilus, that can be caused by viruses. So we have one panel of tests or one panel of primers of DNA or RNA in the PCR, যেটা কিনা আমি পেশেন্টের থেকে লোয়ার রেসপিরেটরি স্যাম্পল নিলাম, ফর এক্সাম্পল স্পুটাম নিলাম, I put the sputum for PCR and I test for 20 viruses and bacteria. তার মধ্যে থেকে একটা পজিটিভ এলো। For example, the patient is suffering from H1N1 or influenza A. I was suspecting Klebsiella, the patient came up to be influenza A. হতে পারে। Similarly, in case of encephalitis, you have a panel, meningitis PCR panel. Meningitis PCR panel এর মধ্যে কিন্তু there is not one target, there are numerous targets. For example, there are suppose 15 targets. কিছু bacterial targets আছে, you have Haemophilus, you have Streptococcus, you have Listeria, you have E. coli and all these things, and then you have some viral targets. Viral targets এর মধ্যে one of the target is herpes simplex. Okay, so that is a thing. Disseminated infection এ কি হবে? The HIV patients, pregnant patient and transplant recipients, mind recipients, not the donors, the recipients, those patients can have a disseminated disease, multi-organ involvement involving the lungs. So you can have a pneumonitis, you can have a tracheobronchitis, and also you can have liver inflammation or hepatitis. Okay, so immunocompromised status A, these are the things that gets affected. Yes, something you want to share? I can hear some hums. You want to share something? No? Then keep quiet. Yeah, so HSV1, as I told, it's a oral or childhood disease. It spreads through close contact. The virus usually survives in the trigeminal ganglion as a latent phase. HSV2 is a genital adult disease. The virus survives or latency stays in the sacral ganglia. Laboratory diagnosis এখান থেকে দেখতে হবে you can demonstrate these multinucleated giant cells if you stain the smear with Wright's and James সেগুলোকে বলবো আমরা Lipschultz body. So this is a inclusion body that you can be that can be very specific for herpes simplex. Virus isolation করা যায় conventional method দিয়ে, that is done, but routine diagnosis, so we cannot do viral cultures. Mostly we do a HSV DNA PCR. As I told, we do a HSV DNA PCR by real-time PCR method, and we can also do antibody detection by ELISA. Okay. Treatment এর মধ্যে Acyclovir is the drug of choice. Acyclovir resistant case you can give something called as Foscarnet. Yes, Foscarnet is the drug of choice when you have resistant cases of Acyclovir. Resistance is there. It is not very rare. We have seen resistance in many cases. In those cases, Acyclovir bondo kore, you have to move on to Foscarnet. Okay. See, antiviral kintu prochur kichu nei. Antivirals are less, not like antibiotics. Antibiotics is a huge number, but generally we don't find so much of resistance in viruses. আর দেখবে সমস্ত ভাইরাসের কিন্তু ট্রিটমেন্ট কিন্তু এখনো নেই। It is not that you will give antiviral and it will go off. No. HIV, can you cure it? No. Right? You can maintain a patient's, you can prolong a patient's life in HIV by giving antiretroviral drugs. But that doesn't mean that ARV cures the disease. That doesn't cure the HIV. Yeah. The next thing is the Varicella-Zoster, your favorite virus which causes chickenpox. Okay. Varicella-Zoster কি হবে? না এটাও তাই, chickenpox bilateral vesicular rashes will directly go to the transmission. Chickenpox is highly contagious. If you are traveling via public transport, মেট্রোতে যাচ্ছ, বাসে যাচ্ছ, রিক্সাতে যাচ্ছ, তোমার আগের পেশেন্ট উঠেছে চিকেন পক্স, অবধারিত তোমার চিকেন পক্স হবেই হবে, কেউ আটকাতে পারবে, ঠিক আছে? বিকজ that is one disease that can spread through aerosols, just like TB. At a closed room এর মধ্যে, if you have a chicken pox patient and that pox patient is constantly coughing and giving rise to respiratory secretion, and if you are coming into close contact, you will definitely have the disease. So that's one infection we are very scared of. It can cause a havoc in the hospital. Generally, chicken pox patients are isolated in a single room, mostly in a negative pressure isolation room, just like tuberculosis. So you have to be very cautious with the chicken pox. It's not that it is a violent disease. Chicken pox is mostly, in the childhood, it is a milder form. But if it occurs in the adult, to the patients who are not vaccinated or who didn't have any kind of previous exposure to chicken pox, then the disease can turn violent. And in case of immunocompromised patients or immunocompromised individuals, the disease can again turn violent. So we'll see. The clinical manifestation, incubation period হচ্ছে 10 দিন, roughly around 7 to 10 days, বলে 21 days, but the symptoms usually appear around 10 days. So there will be rashes. The rashes will turn into phases. Kiki phase? First there will be a macule. So you will see a red spot in your belly, in your abdomen, in your trunk, a red spot. You will think mosha kamdeche. That same day, evening, you will find the red spot has grown into a papule. Papule mane raised. Macule means flat, papules means raised. Okay? Next evening, you will find the papule has turned into something blister-like thing. সেটাকে বলবো vesicle. The vesicle আর papule এর মধ্যে difference হচ্ছে, the vesicle is also raised, papule is also raised. But vesicle এর মধ্যে you will have fluids. So there will be some fluid inside the vesicle. And this fluid, mind you, is teeming with virus. This is the fluid, if it gets into contact with anything, আর সেই ফ্লুইডের কন্ট্যাক্টে যদি আরেকজন আসে, then the person will also have a chicken pox. Then that thing will be turning into a pustule or pus-filled fluid. Ultimately, this will rupture and it will be forming a scab. It is told that whenever you find somebody having chicken pox, that person should be isolated in home or in a hospital or wherever it is till the last scab has fallen off, because ultimately you see this is the resolution stage. Scab ta jotokhon ache totokhon there is a possibility that the person can transmit the disease. So whenever the scab has fallen off, you can put the patient or put the staff or put the individual out of isolation room. Okay, but that is very painful. So this will take around a week or 10 days, sometimes 14 days of time for all the rashes to disappear and to turn into scab and fall off. So there is a particular distribution, centripetal distribution. That means it will spread outside, it will start from inside, it will spread outside. It will be starting off with the abdomen and face, and then they will be involving all the parts of the body. Chickenpox, violent chickenpox যখন হয়, you will find that the lesions are also present in the eye. They can be also present in the genital. It is very painful. The person who have had the disease knows it. And of course, there will be fever associated with it. And every time the fever comes, a new batch of rashes appears and they turn into vesicles or pustules. Complications, most common complication I bollam, secondary infection in the skin. But the complication that we get feared of is CNS. That means you can have encephalitis. You can have cerebellar ataxia. So these are the things that can affect children. These are the things that can affect the immunocompromised patients. And also we have something called as Rice syndrome. That is nothing but a degeneration of liver following aspirin intake in these kind of patients. It is rare, it is not so common. And if you have chickenpox in pregnancy, you can have a congenital varicella syndrome also. Now what is zoster? You will find somebody writing zoster in adult patients. That means whenever the chickenpox has gone it is not gone, it is lying there in your some nerves. So there will be latency in a ganglion, and whenever that thing is reactivated in an adult stage, তখন সেটাকে আমরা বলবো zoster. So zoster is nothing but reactivation of Varicella-Zoster virus in a adult phase, the later part of the life. তো তখন র্যাশটা কিরকম হবে? It will be unilateral and segmental. It will not be the form of chickenpox. It will not be centripetal. It will not be covering the whole part of the body. It will be only covering unilateral. Wait. So you see, this is a phase, or this is a presentation how the zoster presents. So you will have যে নার্ভটার মধ্যে গেছে সেই নার্ভটা যেখানে সাপ্লাই করছে, that part of the body will have the eruptions. Okay, so here we can see something known as Ramsay Hunt Syndrome. Ramsay Hunt Syndrome is a syndrome where we find that geniculate ganglion is affected. Facial nerve je geniculate ganglion ache, সেই geniculate ganglion টা affect হবে, এবং there will be a ipsilateral facial paralysis. Okay, so one side of the face will be paralyzed. There will be vesicles in the face and tympanic membrane. So these are the characteristic features you will find in something called Ramsay Hunt syndrome. It is important for your exams. It can come as a short note. Okay, the diagnosis and characteristics of Ramsay Hunt syndrome. এখানে দেখতে পাচ্ছ the geniculate ganglion of facial nerve is affected. সেখান থেকে you can see clearly the eye involvement here. Forehead involvement আছে, eye involvement আছে. So this is called a zoster. Okay. Next you can have also visceral involvement. সেখান থেকে pneumonia হতে পারে. It is common. Lab diagnosis similar to herpes. You will again have a gene sustained Zank smear. সেখানে multinucleated giant cell পাবে, herpes simplex virus এর মতো. If you do the cell culture technique, you will see the cells are ballooned, they are enlarged, they are rounded appearance. And we do a serology specific ELISA for the detection of antibodies, IgG, IgM, but most important test is PCR. So wherever there is a neuro affected virus, we do generally prefer a PCR because it is highly sensitive and it will give you the result in 3 to 4 hours. If you do a PCR, you will get a result in 3 to 4 hours. See, multiplex CNS panel, as I was telling, multiplex মানে হচ্ছে numerous DNA templates are being added. 10টা ব্যাকটেরিয়া 10টা ভাইরাস থেকে আমি DNA টেমপ্লেট নিয়ে একটা প্যানেল তৈরি করলাম, সেই প্যানেলটাকে নিয়ে আমি একটা স্যাম্পল দিলাম, and if the patient is suffering from any of the bacteria and virus of those 20 things that I have taken, that will be positive. So multiplex মানে হচ্ছে when you are detecting many viruses and bacteria together. Singleplex মানে হচ্ছে when you are detecting one virus only. For example, you are trying to do a COVID-19 RT-PCR. You have given only the gene of COVID-19 as a template. So that is singleplex. Multiplex মানে হচ্ছে there are 10 or 20 organism DNA inside the template of the PCR master mix. Yes. Treatment. Acyclovir is the drug of choice again. So if you find a patient having chickenpox, in the first 48 hours you can give Acyclovir. That will not eliminate the disease, but that will halt the disease progression. Multiple organ involvement হবে না. Total area of not be involved, probably. Okay. So detecting the rash is very important, and it is very important to time the Acyclovir. If you give Acyclovir on the 4th day of the disease, it won't work. So what is the choice? We have a vaccine. Previously there was no vaccine, but nowadays we have vaccine. So it is a live attenuated vaccine. Live attenuated vaccine. It is not a dead virus. It is a live attenuated vaccine. কি স্ট্রেন আছে? Varicella-Zoster ওকা স্ট্রেন বলে একটা স্ট্রেন আছে, সেই ভ্যাকসিনটা দেওয়া হয়। We can give to adults, you can give to children. Children এর ডোজ শিডিউল হচ্ছে 1 year first dose, the next dose is on the 4th year. Adult এর ডোজ শিডিউল হচ্ছে 2 doses 1 month apart. আজকে একটা দিলে পরের মাসে আরেকটা দিলে সেম তারিখে। Okay, so that is how you combat with the chickenpox if you want to prevent it. Vaccine is preventive mostly. And if you have any high risk group or the patients who may develop a multi-organ involvement like HIV, you can give them a post-exposure prophylaxis of immunoglobulin. It is very costly. Immunoglobulin is very costly. So, it is a Varicella-Zoster immunoglobulin. Other herpes virus we will not discuss, but we will just touch. Epstein-Barr virus is there, cytomegalo is there, and yes, human herpes virus 6. This thing causes a disease known as a sixth disease. Very important. Sixth disease is caused by human herpes virus 6. Okay. সেটা আরেকটা নাম হচ্ছে Roseola infantum. This can causes the facial rashes, as you can see in this kid. Transmission again same like herpes, it is transmitted by secretions. Here in case oral secretions. So you will have high fever, you will have rashes. Then you have human herpes virus 7. Again, human herpes viruses are T cell tropic, so they will be targeting the T cells of your system. So this again, it has specific kichu nahi. They have fever, they have pityriasis rosea like symptoms. You can have a GI symptom. Okay, so all these prodromal symptoms can come in HHV7. Next, you have Parvovirus B19. It is a famous virus causing something known as slapped chick syndrome. Okay, we'll see. It is a double-stranded DNA virus. What it causes is it targets the RBC. RBC এর মধ্যে একটা antigen আছে which is called a P antigen. Now this parvovirus targets the P antigen and it causes RBC destructions. So what will happen? You will find anemia. Parvovirus patients there you will find anemia because they are targeting the RBCs and binding to the P antigen of the RBC. Respiratory route transmission hobe ebong jar hobe the kid will look like this. Slapped cheek syndrome. মনে হচ্ছে দু গালে ছাঁটিয়ে চড় মেরেছে। Okay, so that is the characteristic thing you will have. So adults there hoy, but adults their symptoms are different. They will have polyarthropathy mainly in hands and joints, and also the patient will have acute anemia. Okay, so this is what Parvovirus B19 does to you. Also remember, this is called the fifth disease. So, sixth disease is caused by HHV6, fifth disease is caused by Parvovirus B19. Remember? মনে থাকবে তো? Lab diagnosis, again a real time PCR can be used. PCR করা হয় VP1, VP2 জোনটাকে. Next you have human papilloma viruses. Human papilloma virus is again important because they causes something known as warts. HPV causes warts. কি টাইপের হবে? Plantar warts হতে পারে, and then you have anogenital warts. Plantar warts কে বলা হয় verruca plantaris. Verruca plantaris. These are the plantar warts. You can see these are the plantar warts. And then you have, this is caused by HPV1 and you have anogenital warts. This is a STI which is caused by HPV6 and 11. Okay, which is also known as condyloma acuminatum. Next you have pox viruses. Very important, one thing we have eradicated from the part of the world, that is pox virus. Key pox eradicated hoyeche, smallpox. Okay, so smallpox is eradicated. Smallpox is the largest virus. You see the size, it is a 400 nanometer virus. Literally you can see in the light microscope. Our virus is visible in the light microscope? No. There is a virus you can try and visualize under the light microscope. We have not seen because we don't have the access to see a pox virus. I'll tell you why. So this thing looks like a brick. See, looks like a brick or ellipsoid shape. It has a single stranded DNA. This is how it looks like. This has two lateral bodies. Okay, tinte pox virus important. One is variola, one is vaccinia, and one is molluscum contagiosum. Variola is one thing which was causing a smallpox, but now it doesn't cause because it doesn't exist. Okay, it is the first thing that was eradicated globally. Vaccinia is the virus which was developed which was used as a smallpox vaccine. Okay, and molluscum contagiosum causes some skin lesions which looks like warts. This is how it was looking like when we had smallpox on the earth, variola major, variola minor. This was the timeline. So what happened is in 1975 there was the last case of variola major, okay, and that was probably in Assam. Yes, that was in Assam. In 1977 there was a last case of variola minor. It was in Somalia, okay, and 1978 there was accidental spread from the lab. Some lab in UK, they had some accidental spread of the variola. In 1980, the virus was declared eradicated from earth by WHO. So, do we have variola now in earth? Yes, we have. Kothay ache? Duto jagate ache. One we have in Atlanta, US. So, we have some variola virus which is preserved in the CDC lab in Atlanta, which is highly protected. You cannot have access to the virus anymore. And then you have in Russia, there is one biotech center, then you have Russia to ekta stock ache. So, two stocks of variola are existing now, one is in US, one is in Russia, but you cannot gain access to it, okay. But there is one problem, as because we have eradicated the disease, we are not vaccinating, right? Disease ta nahi vaccine ki debe tum, okay. So, it is an ideal bioterrorism weapon. None of the people born after 1980s are vaccinated, correct? So, we are not vaccinated against smallpox. So, what happens is, if you are not vaccinated and you have certain agent which is a class 4 agent, if you spread it, then it kills many population or it affects many population, because none of the population is vaccinated for smallpox. The same thing that happened with COVID-19. We were not vaccinated for COVID-19. Okay. So, it is a potential threat or is a highly active bioterrorism agent. Okay. So, previously আমরা smallpox vaccine দিতাম vaccinia virus থেকে, it was a live vaccinia vaccine. তারও আগে দেওয়া হতো cowpox vaccine দিয়ে, okay. Cowpox is a different virus that was injected inside a human being so that that person develops similar immunity to the smallpox. তারও আগে দেওয়া হতো variolation. Variolation means যাদের smallpox হয়ে গেছে সেই পেশেন্টের স্কিন স্ক্রেপিংটা নিয়ে একটা হেলদি পেশেন্টকে দিতে হতো, so that antigen is a foreign antigen to the individual and that develops the antibody against the smallpox. That was the whole intention. Then you have molluscum contagiosum. Molluscum contagiosum again is a family of the pox virus. Ki korbe na, they produce certain dome shaped lesions, pink pearly white lesions which are dome shaped, which have a central umbilication. Single hote pare, multiple hote pare, they can be found in every part of the body except palms and soles. They can be found in the limbs, they can be found in the abdomen, they can be found in the face, but you will not find in palms and soles. So, this is molluscum contagiosum. These do spread through the normal contact when you go to barbers, when you go to swimming pools, all these things can give, and this is common, this is not very rare. So, it is a self-limiting disease, you do not have to do anything, it will resolve by itself within 3 to 4 months. Generally, no medication is given. You can do a confirmation by lesion theke PCR korle, you will get a virus of molluscum contagiosum. Next, you have measles. Again, a very common disease, measles and rubella, a very common disease of the childhood. So, what happens is this thing spreads through respiratory droplets, as I said before. School e beshi hoy. School e beshi hoy keno? Any kind of respiratory infection jodi ekta ghorer moddhe, school e to ghor thake, sob section thake, class thake. So, many things, many places they are not well ventilated. They don't have exhaust systems. So, if a child is affected by something or respiratory viruses or respiratory droplet infection, that child will produce aerosols inside the classroom. সেই aerosols অন্যের মুখে যাবে, অন্যের respiratory secretions এর মধ্যে যাবে, and that will produce the disease. So the suspended particles will be having the measles virus, which will cause the disease. কি হবে? They will be firstly going into the respiratory epithelium, lungs এ যাবে, okay? Lungs এ গিয়ে primarily they will go to the lymph nodes. Lymph nodes এ একটা multiplication হবে, সেখান থেকে they will spill over to the bloodstream. So the first viremia occurs from the lymph node. Lungs এ গেল, lungs থেকে আমার lymph node এ গেল, lymph node থেকে jump করলো blood এ। এবার blood থেকে যাবে সমস্ত organs এ, they can go to liver, they can go to kidneys, they can go wherever they want to go. Then there will be again multiplication and amplification. সেখান থেকে আবার they will jump to the bloodstream. So that is secondary viremia. So primary viremia হলো, secondary viremia হলো, তারপরে they will produce the disease. Okay, কি কি symptom থাকবে? You will find something known as very specific, known as Koplik spot. Okay, এই molar tooth এর পাশে on the buccal mucosa you will find some Koplik spot. That is a very characteristic for measles. And you will have rashes on the face. So as I said, day 10 এ fever আসবে, when the starting of the infection the day 0 হয়, day 10 এ fever আসবে, day 12 এ you will find the Koplik spot, day 14 onwards you will find the rash. So the rash will be coming 2 weeks after the exposure of the infection. র্যাশের ফেজটাকে আমরা বলবো ইরাপটিভ ফেজ, আর কপলিক স্পটের ফেজটাকে বলবো প্রোড্রোমাল। Prodromal means all the generalized symptoms like fever, like malaise, like weakness, all these things are called the prodromal symptoms. Next কি হবে? measles হয়ে গেল, eruptive phase শেষ হয়ে গেল, patient is getting better. Now what happens is the patient is going into weight loss and weakness. That is the complication, or that is the late stage of the measles, which generally occurs after 3 weeks. Measles complication is very important. If you have again immunocompromised patients, HIV patient, pregnant patient, child below 5 years, those people can get complicated. They can have secondary infections in the lungs, they can have secondary infection in the ears, and they can have so many things regarding other organs, and the most dreaded organ is CNS. CNS এর মধ্যে you will have subacute sclerosing panencephalitis, or called SSPE. That is a complication of measles. Remember, gastrointestinal tract malnutrition, diarrhea, all these things can occur. Respiratory tract you can have giant cell pneumonia, সেটাকে বলে Hex pneumonia. Okay, these are the small things you can jot down, you can remember, and you can write in the exam. Lab diagnosis, it is mostly diagnosed clinically, but if you want to do, you can isolate the virus, or you can do a viral RNA PCR, or you can do a ELISA for detection of the antibody. But mostly we diagnose it clinically. Specific antiviral কিছু নেই, symptom আসলে supportive measure দেওয়া হয়, vitamin A can be given for the symptoms. Measles vaccine, this is a very complicated chart, but don't pay attention to all the things. Concentrate your mind into these vaccines. We have 3 kind of vaccines. A vaccine which is a mono vaccine, that is measles and rubella, MR vaccine. Then you have mumps, measles and rubella, MMR. Then you have MMRV, that is mumps, measles, rubella and varicella. Combined 4 things together. Okay. Key timing, first dose is given by after 9 months till 12 months. So 9 to 12 months is the dose, and then after 16 to 24 months, মানে 2 বছরের আগে, you have to give the second dose of the MMR vaccine. You have next is the rubella. Rubella is nothing but they are called German measles, similar like measles. Only thing is that they can cause something called congenital rubella syndrome, which is highly virulent and it is very problematic in pregnancy. It is again spread through respiratory droplets, local lymph node, multiplication, সেখান থেকে viremia হবে after 7 to 9 days. It can symptoms like this. Okay, so what happens is there is a distinctive rash in the face, in the trunk, and the most striking feature is there is a lymphadenopathy, jeta ki na measles e chilo na. German measles or rubella te you will have a lymphadenopathy. Kothay kothay hobe? Occipital and post-auricular. Post-auricular and occipital. So these are the two places where you will find lymphadenopathy. Aro kichu characteristics things royeche, jemon Forsheimer spots. Forsheimer spots is nothing but some micro spots which you can see in the uvula, soft palate uvula te you can see some reddish spots which are called Forsheimer spots. Lab diagnosis, same thing, only thing is that ekhane sample would be a throat swab or a nasopharyngeal swab. Jehetu respiratory droplet de dukche, the sample is a nasopharyngeal and a throat swab. Ekhan theke you can do a viral culture, you can do a PCR. Prevention, I have already said we have vaccines, combined vaccine of mumps, measles, rubella. First dose is given at after completion of 9 months, 9 to 12 months, and the second dose is at 16 to 24 months. The last virus of today's discussion is hand, foot, mouth disease. That is a virus which causes infection which is very common nowadays in school going children. Okay, অনেকেরই হয় hand, foot, mouth disease. If you see your environment, if you see your locality, many people, many kids who are going into school, who are going into play schools, they will have this rashes. Suddenly they will be having fever and suddenly they will be having rashes around their mouth and their hand and feet. That is why it is called hand, foot and mouth disease, HFM. Okay, HFMA kichu vesicular rash hoy, as I told, the kid will also have fever, sore throat to ora bolte pare na choto bachchara, but if you ask them they will tell you that at a problem hocche golate. So it is spreading through again all the secretions, respiratory secretions, saliva, sputum, nasal secretion, etc. The virus which is responsible for this is Coxsackie virus. Okay, Coxsackie virus is the thing which is responsible for hand, foot, mouth disease. It is generally not treated. It is a self-limiting disease. By 14 days, the lesions dry off and the patients get better. But there are certain complications of hand, foot, mouth disease, like you can have nail dystrophy. The child will suddenly find that the nails are getting brittle. You will think that the child is having a fungal infection, but no, that is a complication of hand, foot, mouth disease. It is a rare complication, but it can occur. Okay. So I think I have covered most of the viruses that causes skin infections. You read important ones. Smallpox is very important. The smallpox eradication, why it is eradicated is very important. Okay, short notes may come. Varicella is also important. Herpes simplex is important. HSV.